strength, which can help prevent injuries and prevent falls.
In this week's Healthy at Home, we're looking at specific exercises which you can do at home.
Yeah, Jessica Shaban is a registered nurse and owns Advanced Home Healthcare. Thanks for coming in.
Good to see you again.
And then Kendra Jorgensen is a personal trainer, and she does a lot of other things as well.
Yeah.
So thanks
Nice
for
to have
coming in
you
this
here.
morning. So Jessica, what are we emphasizing today?
Well, basically, there's often a misconception out there that seniors can't increase strength and shouldn't exercise. But we're here to explain that it's vitally important to help prevent falls and injuries. And of course, they should consult a doctor first before starting any exercise regimen. But it's important to learn that it is possible and it is something they should do.
Well, there can be serious consequences when it comes to falling as we get older, and a lot of us who have seniors in our lives, we know those risks, but would you explain them?
Absolutely. Oftentimes, falls or injuries in senior citizens can land them in the hospital, and it just takes a lot longer to recover from that and can lead to other comorbidities that can cause a cascading effect and decline of health.
Yeah, Kendra, let's talk to you for a second, because what can seniors do when it comes to exercise?
Yes, there's a lot of at-home exercises that you can do, whether from going through a gym or not. It's very important to have axial loading, so self-reacting with gravity, weight training, moving around, just not sitting down. Anytime you're sitting down, you're going to decrease the chance of building new bone mass. So we call that osteoclastic activity.
So you want to move around.
Boy,
you want to move around.
You know
always
a lot
stay
of
on your
big
feet.
words. Do you want to join Mensa? As we were talking to Diana earlier, I feel like you maybe should. So right now we're looking at some terms there: elasticity in tendons, the importance of stretching. Can you show us some exercises, and we'll get back to that here in a second, but I guess we'll stick with the graphic for now.
So
And
you
in
hold
terms
these
of
for about
exercise
60
in the body.
seconds, so about a minute is when
about
you
a minute.
hold these stretches?
At the age of 60, you should start holding your stretches for about a minute or longer, just because of the elasticity
So
issues.
you get the proper stretch.
And so 65 as a threshold, that's a big year for us in
big
terms
year
of
for you.
the decline of strength.
Yep.
When we really start, we need to think more actively about exercising. And then can you show us a couple of exercises here? And Jessica, you said it. To reiterate it for our viewers, check with your doctor before you do anything so they know what you're doing and they approve of it. But once you have that conversation, then maybe you could try these. So what would you recommend?
So first would be just a basic balance. Obviously, we want something to stabilize yourself with to reduce the risk of falls. So anything, a countertop or chair, just standing, lifting up one leg, balancing on one foot, creating a little proprioception action going on, and then you come back down. And a strengthening exercise for your hamstrings, you could just simply curl your leg up and switch legs just like
Now,
this.
do you want to hold it? Do the seniors want to hold it when they get up to that point, or just up and
A
down?
nice little 1 to 2 second hold, and then all the way down. So the ratio should be 2 seconds up, 4 seconds down.
Important to balance yourself on
make
the chair,
sure
though. Yeah.
and make
Always
sure
have
that it's
something.
on something sturdy so that the chair isn't sliding
Yes.
around in front of you, or a countertop, as you
Exactly,
mentioned.
yep.
Anything we can do seated in the chair instead of
Yes.
just standing behind it.
So if you want to take a seat, who wants to be my subject for the
I'll do
squatter?
this, I'll do
Give it
this
a
part.
shot.
All right. Sit down?
Jessica, you want to come over with me?
Sure.
So what you can do, first movement of standing up from a chair is to lean forward slightly
Okay.
and engage your core
Okay.
and your legs and stand up, really focusing on not bending too far forward.
Is that where people make the big mistake, is leaning forward too far?
Yep,
and getting
or
up?
bracing themselves with their arms rather
arm
than
like this.
engaging their core and their lower extremities
Right,
to
because
raise
when
up
you're
from the
using your
chair.
arms, you're not using your lower muscles and your legs.
And you know what else I'm thinking about is you start rocking,
Yep, the
right?
rocking.
You try to get some sort of
Yep.
momentum to then get
Exactly.
up and kind of launch yourself out of the chair. So doing those exercises will help you keep the strength in your legs so you're able to do it alone.
How does this all translate back into home health care?
Well, basically, it can be implemented into the plan of care for the patient. So when I come and do the free assessment, the initial consultation, these are things that we can implement with the doctor's permission again. But it just is really essential because, as Kendra knows and talks about, people lose that strength after a certain age. It's just a physiological thing. And they have to do what they can do to maintain it or increase it back up.
So you can have a professional like Kendra come into the home and work one-on-one with someone that you're already working with.
Yes, absolutely. We can
Yeah.
implement that into their whole plan.
And it's so important to have somebody working, if it's your mom or dad, maybe it's you, who knows what they're doing. And that brings us to your credentials. You've got quite a few letters behind your name, Kendra. So what does it all mean in terms of how the rest of us benefit from your education and experience?
I got my master's in arts and exercise science from University of Nebraska, Omaha. And I'm also a strength and conditioning specialist from the NSCA. So.
And there's the list right there, right?
And a personal trainer, so
And a
working
personal
with
trainer as
everybody.
well, yeah.
Yep,
Yeah.
Lifetime Fitness.
Yeah.
Okay, so how do people take advantage of this? If you know a loved one at home, or if you're at home yourself and you think that this type of care would be good for you.
Jessica?
Yeah, basically, again, when we go back to the initial free consultation, it's just something we could talk about and assess the home situation, assess the patient, and from there go through the proper steps, talking to the primary care physician, the family members, and just really get engaged with that. But it's such a misconception that, you know, senior citizens shouldn't do this, but it's vitally important.
Well, those falls lead to so many other injuries
Yeah.
and can really be disastrous.
Prevention
Yes.
is so important, and as we were looking at a close-up shot when she was doing some exercises, I noticed some colorful bags that are still on the floor. So what's the story with the gifts, Jess?
Oh, what's this?
Well, I just figured when you guys head to the gym, you can put these on.
Thank you.
What do we got in here?
Yeah, well,
Check it
we're
out.
not
check it
65
out.
yet, but it's still important to work out, isn't it, for
Absolutely.
all of
Like you
us?
said, prevention is the key.
Oh, yeah,
Nice.
shirts. Thank you very much.
Nice.
You're
nice.
very
Right
Well,
there.
make it a
welcome.
mess. Thank
Advanced
you.
Home
We're
Healthcare.
big fans of Advanced Home
We
Health
are.
Care. And if you would like to learn more, you're welcome to go to homehealthcareomaha.com. And Jessica's put together a great video there. It's informative. So take a couple of minutes, watch the video. If you'd like to learn more, shoot her an email or call 402-490-3120. Also on Twitter and Facebook, so keep in touch.
Thanks for coming in.
Thank you.
And
Thanks
look
for
at the
having
mess,
us.
Look at the
Thank
mess
you.
that Mary left right over here. I put mine nice and neatly on the chair.
Oh, listen.
Thanks for coming in, guys.
Thanks for having
Thank
us.
you.
All right, we often hear from people who